India is known as the diabetes capital of the world, with every sixth diabetic adult in the world from the country, and majority in urban areas. Today, 11% of Indians are diabetic, and a whopping 15% are on the verge of developing it. Alarmingly, more than half of the Indians with diabetes don't even know they have the disease. Type 2 diabetes is the most common form of the disease in the country, with 25% of those below the age of 25 who are diabetic suffering from it. Yes, our genes do play a role. We have a disposition towards belly fat and we have earlier onset of diabetes, with Indians developing diabetes earlier as compared to, say, the Chinese, Japanese or Europeans. But it's our lifestyle that is also fueling the fire. Today, 1 in 4 Indians are obese and over half of the adults do not meet exercise guidelines. That's probably why the term diabesity, the deadly combination of diabetes and obesity. And lastly, lest we forget, living with diabetes isn't a walk in the park either. India suffers from high rates of chronic complications from diabetes, ranging from retinal damage to nerve issues to kidney problems. Today, we're diving into the world of diabetes with renowned endocrinologist Dr. David Chandy. We're addressing questions such as, can diabetes be reversed? Can thin people get diabetes too? Can you live a healthy life with diabetes? Welcome to the show.
There's a lot of, consumption of oily food, maida, refined flour, sugar, jaggery, honey. We are called as the thin fat Indian phenotype. That means although our weight and our height may be normal, we have a large belly size. So we spend a lot of time actually counseling them that medicines later, let's talk about your life. Sleeping at 2 a.m. and waking up at 9 is not correct. Our body has an internal clock. We call it the circadian rhythm. So jaggery is natural, but where does jaggery come from? It's the same sugar cane and you get the same sugar out of sugar cane. For a diabetic person, we say you need to stay away from sugar, jaggery and honey.
Doctor, we're discussing diabetes specifically as a non-communicable disease. If we could just start with the simple question about why India is known as the diabetes capital of the world.
Yes. So as you mentioned earlier, the prevalence of diabetes has gone up a lot in India. So currently the statistics show that almost 10 to 12% of the adult population in Indian cities have diabetes. The number one reason for this is change in our lifestyle. There's a lot of, consumption of oily food, maida, refined flour, sugar, jaggery, honey. So if there's any function, now be it, Holi recently or any birthday, go back and think, what did you eat? It would be something out of maida or something sweet. Similarly, what's happened is we are not paying enough of attention to exercise. Sadly, most of us are so focused in our work or studies. What happens is we just neglect our exercise. So at least we need to focus half an hour per day for our exercise. The next thing is lack of sleep. We are so engrossed in our work or studies, we don't focus enough on our sleep. At least 6.5 to 7 hours of sleep is needed. And if we think back, hardly one of us gets so much of sleep.
Okay.
So these are the 3 main reasons.
Okay, so you've alluded to mainly lifestyle factors being the key reason for us being the diabetic capital of the world. Is there any genetic component to this as well?
Yes, so the second important reason is genetic. So our genes especially are prone to one thing. We are called as the thin fat Indian phenotype. That means although our weight and our height may be normal, we have a large belly size. So this visceral fat or the fat in this belly region makes the insulin weak. And if insulin is weak, the pancreas gets exhausted making more and more insulin. And one day it stops working. That is when the sugars go up. So what we need is, we need to reduce this belly fat.
What do you see in your clinic mostly with patients who are walking in with diabetes?
So I see a combination of both these factors, both genetic, especially people who have their parents who have diabetes, a lot of them are coming with diabetes. And second is many of them have this issue of food. They usually have a lot of carbs, lot of maida, lot of sugar or jaggery in their meals. And second is none of them have time or the inclination for exercise. So we spend a lot of time actually counseling them that medicines later, let's talk about your life. How is your food? How is your exercise? How is your sleep? And then the last maybe quarter or last 10% of the time we devote on medicines.
Okay. How critical is sleep to probably managing or to preventing diabetes?
So it's very important. In fact, we only know about the importance of sleep and diabetes since the last 5 years. It was the most neglected part. Till now, we were only focusing on food, exercise, and medicine. But there's been a lot of research in the last 5 years talking that if you have good sleep, your stress hormone called adrenaline and cortisol, they calm down. If they go down, they really help in controlling the sugars. So it's important that we sleep, number one, in a good time interval, and second, at the correct time. So many people say that I sleep, good 7 hours, but sleeping at 2 a.m. and waking up at 9 is not correct. Our body has an internal clock. We call it the circadian rhythm. So we are supposed to sleep few hours after sunset. So ideal time to sleep would be around 10, and a good time to wake up would be around 5:30 to 6. That is the correct way to sleep and a good thing that if you could do.
Okay, I'm going to get to what an ideal lifestyle would be to prevent diabetes. But before that, you mentioned Jaggery. A lot of people come saying that they're eating Jaggery in their meals. But many people also don't think that Jaggery is sugar. Do you have to bust a lot of these myths?
Yes, so almost 99% of the patients who come to me, they say Jaggery is so healthy. All of us, health coaches recommend Jaggery. So Jaggery is natural, but where does Jaggery come from? It's the same sugar cane, and you get the same sugar out of sugar cane. So chemically, both of them are sucrose. The only difference is Jaggery has little bit more of fiber, little bit more of iron content. But for a diabetic, it will spike up the sugar at the same extent. So for a diabetic person, we say you need to stay away from sugar, Jaggery and honey. Many people think that Jaggery and honey both are natural, so they're healthy. But they contain lot of sucrose and glucose, which will trouble the sugars.
Okay, does that also apply to fruits?
So to a smaller extent, because fruits have lot of fiber, which is not there in Jaggery and not there in honey. So again, in fruits there are two categories. Some fruits which have lots of fiber, like apple and pear, orange. So we would prefer these fruits more. The other group of fruits which have less fiber, like ripe bananas, mangoes, grapes. So if you have too much of these fruits, then again the sugars will spike up. So you need to discuss this with your doctor. If your sugars are well controlled, then the doctor would say, okay, all fruits are fine. But if the sugars are not good, then the ones which have less fiber and more of glucose, those fruits will be off the table.
So just give us a sense in terms of if you had to illustrate a person's day, what would be an ideal lifestyle for a person to even prevent or manage diabetes?
Okay, so the lifestyle will cover three things. So first is the food. So one is again importance of the timing of food. Many people have an erratic lifestyle, and sometimes what happens is the meals are delayed a lot. For a diabetic, it's very dangerous if they delay their meals and if they are on medicines. It can lead to low sugars. So they should be disciplined with respect to the time, and an ideal plate should look like how a traditional Indian thali looks like. That means at least half of the plate should have good amount of fruits and vegetables. Quarter of the plate should be the carb, and quarter of your plate should be protein. Now, we Indians traditionally have a carb-rich diet. So we have a lot of rice in South India, or in Northern India we have a lot of roti. It's common that my patient says, I have 4 to 5 rotis, it's usual. But that's fine for a farmer. How much of us are farmers? How much of us are doing such a heavy work? We sit in offices with a laptop, so we don't need more than 1 or 2 rotis. We need to increase the fiber in our diet, have more protein. So a similar principle for lunch and dinner. So we need to have 3 meals and 2 small snacks. Maybe a mid-morning snack like an apple or a pear, and an evening snack, something again rich in fiber like a fruit, or something like a makhana, fox nuts, or something like roasted chana, or something made out of pulses like a dal chilla. They are good snacks for the evening.
But what about fat?
So fat, so reasonable amount of fat is safe. So like we talked earlier about, cholesterol and fat. So a reasonable amount of fat would be like a rough rule of thumb. We say that if someone is consuming oil, it should be less than half liter of oil per person per month for a family. And if it's ghee, we say simple, it should be less than 1 teaspoon per person per day. So this much amount of oil is good for you to manufacture your oil related hormones. So some hormones are produced from cholesterol. So we need some oil for that. We can't make a oil consumption zero.
Okay, all right. So that point is taken. Can you explain the difference between type 1 and type 2 diabetes for us?
Yes. So it's very interesting. Type 1 basically means an insulin deficiency. So all of us during COVID times, you would have heard of something called antibodies. So antibodies are something that protects us from infection. But sometimes there can be a problem in the internal signaling of the body, and the body can release some antibodies that trouble the pancreas. In that case, the pancreas is shut off. If the pancreas is shut off, the insulin level in the body becomes zero. That time the person has insulin deficiency and the sugars skyrocket up to 400 and even above that. So there's only one treatment for type 1 diabetes, which is insulin. Now scientists are still trying to find out what is the exact trigger for type 1. There are some genes known to be causing this, and there are also some theory that it could be some pollutant or some allergen which is triggering the immunity. Type 2, which we commonly see, which India currently has a big explosion of cases, is related to genetics and to obesity. So like we discussed earlier, it's because of the wrong food habits, lack of exercise that we're seeing in type 2. What happens in type 2 diabetes is there's more of central obesity. So there's a more appearance of a big belly fat. If you look at the person's back of his neck, you'll see some black color discoloration. That means because of the belly fat, the pancreas is unable to make enough amount of insulin and get the sugars controlled. So pancreas tries to make more and more insulin. So what will happen is the insulin level goes up, there's a black discoloration behind the neck, and then the patient gets fatigued, and then we check the sugars after a few months to few years, the sugars start going up.
Okay.
So here tablets have a role. So in type 2, the major difference is people respond to tablets, and in the initial years, if they are very disciplined with food, exercise and sleep, and they reduce their visceral fat, they can even reverse their diabetes. They can even maybe go off medicine. So that is possible with type 2.
Okay, but for type 1, it's irreversible.
It is irreversible. But for type 1, there's an interesting phenomena called honeymoon phase. That means if they're well controlled with insulin for the first few months, then maybe for 3 to 6 months, they can even go off insulin. But that's always a very short period. So we call that honeymoon phase, when luckily they don't need that painful insulin.
Okay.
But that's a very temporary phenomenon.
So for children, are you seeing, or younger adults, are you seeing more type 2 cases as well?
Yes, so this is a recent trend in India since the last 10 years, because again with lot of pressure on them to study, they're not getting enough time to exercise. And from a very young age, they're exposed with too much of maida, too much of sugar, jaggery, honey, and poor kids have no time to sleep. It's the huge burden of academics that's troubling them. So we're getting a lot of, it's like a dual epidemic, both of obesity and of diabetes. So a lot of kids who are having obesity issue and lot of kids having diabetes.
So what do you recommend to them? Just switch your lifestyle over?
Yes, definitely that's the first step. Second, if needed, medicines.
Okay, all right. There's this misconception, is it a misconception rather, that only obese people can be diabetic, or can thin, fit people also be diabetic?
Yes, so like we discussed earlier, in type 2, there's a huge proportion of patients who are genetic. So suppose if one parent has type 2 diabetes, there's a likelihood that around 30 to 40% of their children will get type 2 diabetes. If both the parents have diabetes type 2, then 60 to 70% of children will have type 2 diabetes. So this proportion of patients who are having genetically type 2 diabetes, in them usually even if they are thin, they cannot reduce their genetic risk. So in them definitely lifestyle will help to delay, but their chances of diabetes are still high. So in this proportion of patients, even if they are good with diet, exercise, we can delay their diabetes and we can maybe manage them with less medicines. But in them to reverse their diabetes is tough because it is genetic.
Okay. How does one determine if they are pre-diabetic, and what are the signs and symptoms of being pre-diabetic?
So diabetes is like a silent disease. So there are not much of signs of pre-diabetes. So pre-diabetes means nothing but borderline diabetes.
Okay.
The only symptom that we get of pre-diabetes is the body's pancreas is exhausted. So the insulin levels are, on the higher side. Pancreas is making more insulin and getting tired. So behind the neck, there'll be black color discoloration. Medically, we call this acanthosis, means black color discoloration behind the neck. That's the only sign. There will be no other signs.
Okay.
But in these patients, if you're vigilant, you should get their sugars checked at least once a year. So there's a simple test called HbA1c, which tells us how good or bad the last 3 months sugars were. So a value above 6.5 means it is diabetes. A value between 5.7 to 6.4 means it is pre-diabetes. So that's the test that helps us determine whether someone has pre-diabetes or not.
And this is across age groups?
This is across age groups, across the world. Any race, any population, this is the cutoff.
Okay. What are the long-term side effects of poorly managed diabetes?
Okay. So long term what happens is when the sugars are high, they will block the small narrow arteries of the body. So there are three organs which are very susceptible for this. One is the eye. So the eye has a screen called retina. The blood flow to the retina becomes weak. So the retina can't pick up the images. So you'll have blurry images. That's the sign that the eyes are weak. Second, the blood flow to the kidney also has this fine arteries. So if the kidney is damaged, initially the kidney membranes become weak and in urine there will be high protein. So that time the doctor will ask to check the urine protein levels. At later stages the kidney will stop working. That's when the blood creatinine level goes high and the body has a lot of swelling. The third organ is the feet. The nerves of the feet have very fine blood supply. They get blocked. So initially there will be pain for the first few months to years. And if that's neglected, then the nerve becomes dead. At that time the sensations to the leg are lost. And if there's some wound over there, we neglect the wound and it becomes a large ulcer and could lead to a severe gangrene.
But what if your diabetes is well managed? Would you
That's the
still
good thing.
face such kind of complications?
So since 1990s, there was a lot of research, both in US and UK, and they found out that if your sugars are good, you can prevent all these complications. What do we mean by that? If you keep your fasting sugars always below 130, post-meal sugars always below 180, and your 3-month average test called HbA1c below 7, it's proved beyond doubt for the last 30 years, you can prevent all these three complications.
Okay.
So that's why it's important that you focus on your lifestyle, take your medicines on time and check your numbers frequently.
Okay. All right. Are GLP-1 drugs recommended to treat diabetes?
Okay, so it's a very interesting group of drugs. We get a lot of questions on this of late. So they were very popular in US and Europe from the last 2 years, more for obesity. Like we said, diabetes and obesity like are part of the same spectrum. We call it nowadays diabesity because they are part of the same spectrum. So in that, this is a magic drug. What it does is, it reduces the size of your stomach. So a person who's having 3 rotis, after 1 roti now will feel full. At the level of the brain, there's a center called hypothalamus, which decides whether you're hungry or you're full. It stimulates that and makes you feel less hungry. So the craving comes down. The craving for junk food comes down. It also improves your metabolism and also releases insulin when needed. So it meets all these parameters. So it works well, but there are 2 issues. One is it's very expensive. Second, the side effects. So many Indians don't tolerate it. In India, you get the tablet form of a drug called semaglutide. Many people have side effects, like they have a lot of nausea, vomiting. Almost 20 to 40% of my patients do not tolerate it.
Okay.
So we need to counsel them well. If you're taking this drug, please stay away from foods like pani puri or something spicy or something that's oily. Otherwise, it can trigger some stomach reaction and you'll have severe vomiting or loose motion.
Okay. What is the most effective treatment that you recommend then?
So for diabetes or for this group of patients, it's always lifestyle. Good amount of sleep, exercise and food. And if medicines are needed, then GLP-1 is the one that is recommended. But we need to explain them both, the cost involved and the side effects.
Okay. All right, Dr. Chandy, we have a lot more questions. This is in our rapid fire segment, which is just after a short break. Stay tuned. Welcome back. Well, you're still tuned into Health Matters on the Medicine Box on CNBC-TV18. We have Dr. David Chandy discussing diabetes with us. And this is our rapid fire segment where we have a lot of questions coming to us from viewers and people who do suffer from diabetes or have somebody in their family suffering from that. And basic questions which they want answers to. So the first question, Dr. Chandy, is type 2 diabetes reversible with only lifestyle changes?
Yes, but there's an important catch to it. It has to be in someone who's obese, because only if there's a weight loss will the diabetes reverse, and it should occur in the first few years of diabetes when the pancreas is still fresh. If the pancreas is tired and it's been more than 5 to 10 years, it's unlikely that the diabetes would reverse. So recent onset diabetes in an obese person, the answer is yes.
Okay. Will all obese people get diabetes?
No. So obese people, some of them luckily have good genes, even if they're obese throughout their life, they may not get. But a majority of them have a high risk for diabetes.
Okay. Is long-term use of liraglutide safe for diabetes management?
Yes. So this is a new drug studied well for the last 10 to 15 years. So it is safe in the long run.
Okay. Any common misconceptions about diabetes?
So couple of misconceptions are very common. One is like, what is an ideal diet? So there are lots of things on internet, on Facebook. But the most common thing to remember is a balanced, simple diet is the best. You need to have something that is sustainable. So that is the most important misconception. The second is exercise. Many people say that exercise is good, cycling is good, or swimming is good. So the thing is, whatever you enjoy, that is going to be sustainable. So do something that you enjoy, that brings a smile on your face, and do it for the next 30, 40 years of your life. That will be the best thing.
Okay. Alcohol and tobacco, its relation to diabetes.
Yes, so two important things. Alcohol increases your visceral fat. And we spoke earlier that if your visceral fat or your belly fat increases, your sugar control will be poor. Now, smoking has an interesting relationship. In diabetes, like I mentioned, that the blood flow to the leg reduces, and smoking troubles this further. So it is seen very commonly that in smokers who have high sugars, they develop leg wound that don't heal and they need amputation for gangrene. So if there's any smokers, it's important that if they're detected to have diabetes, they need to stop smoking immediately. Otherwise, they have a high risk of gangrene.
Okay. Common signs of being pre-diabetic or diabetic, and when should you get checked?
Yes. So like we mentioned, pre-diabetic is a silent condition. In some people, you will see a back color discoloration behind the neck. In diabetic, in the initial phases, it will be quiet. But when it advances and when the sugars are very high, one symptom would be passing lot of urine. And in olden time, the word for diabetes comes from, passing too much of urine. That's the actual meaning of the word diabetes. Okay. So anyone whom you see passing urine frequently, you should think of diabetes. Second is if a person comes out from the bathroom and says that there's a lot of ants running towards the bathroom, that means the urine has more sugar. So that was an old symptom that, people would check for, diabetes. The other symptoms are weight loss because you are losing calories. The other symptom is hunger. So the last symptom would be increased risk for infection. So if someone is having increased hunger, increased thirst, lot of urine and skin infection, check for diabetes.
Okay, and lastly, what are the other strategies that can help control diabetes besides just exercise and diet?
Discipline in taking medicines and discipline in monitoring your sugars. Many people think things are good and then they forget to check their sugars for months and then they land up with complications. So every day I see 2-3 of such patients. They did well for the initial few months and then they go to a comfort zone and they go within their shell and they stop monitoring and stop meeting their doctor. And then they land up with a complication like a kidney infection or a wound in their leg and then they regret. So even if you're doing good, please don't forget to monitor your sugars.
Okay, and can you live a successful, happy life with diabetes?
Absolutely. Be it type 1 diabetes with insulin or type 2 diabetes with your lifestyle and medicines, you can absolutely live a healthy, happy life.
Okay, all right, Dr. Chandy, thank you very much. It's been a pleasure for giving us so much knowledge on diabetes and busting a lot of myths as well. Thank you very much for joining in.
Thank you.